This episode is brought to you by Innovative Consulting Group. Since 2002, Innovative has delivered flexible solutions and next level service, helping healthcare facilities nationwide meet their unique HIT challenges. Over the years, Innovative's offerings have grown, but even as its services have expanded, its mission remains the same: to serve as a true partner to clients by providing healthcare's most agile IT solutions. Visit thisweekhealth.com/innovative consulting group. That's innovative consulting group to learn how Innovative can help you stay ahead. Hey everyone, I'm Drex DeFord, one of the principals at This Week Health and the 229 Project. Here, our mission is healthcare transformation powered by community. This is Newsday on the Unhacked channel, breaking down the cyber and risk stories that are impacting healthcare. Here's some stuff you might want to know about.
All right, well, welcome to Newsday. It's Drex and I, along with Dave Dyell from Innovative Consulting Group. And today's conversation I already love. As we were planning for some of the specifics we're going to cover, we've got data archiving or application archiving and rationalization. Like, what an important topic right now. Everywhere we go, people are talking about those things. AppRat, which is such an unfortunate name to call it. We should think of something far fancier to say than that. But more than that, it's like, how are you going to rationalize your portfolio? And then how are you going to archive it in a way that's meaningful while still meeting all the different requirements, regulatory, et cetera, and managing the cost and the expectation of some of that in the different environments. So Dave, thank you so much for being here with us today.
Glad to be here. Look forward to the conversation.
Yeah. Drex, your thoughts on some of this stuff?
Well, I'm just thinking you all just wrote a blog on this. And I mean, in the spirit of like everything's connected to everything else, I think about the pressures that health systems are under right now financially, from a cybersecurity perspective. Operations have to run perfectly. We can't have any downtime, whether it's cybersecurity related or if it's self-inflicted. We're always being asked to do more with less. Part of that ultimately has to come down to, how do I look at this huge number of applications that I have in my inventory? We were on the road last week. We're on the road next week. We're going to be talking dozens of health systems. And it's a story that comes up over and over with them. Like, we've got 600 applications. We've got 900 applications. There's a lot of duplication. How do we get ourselves out of this mess? How do you guys work with health systems to help them get out of that mess?
Yeah, I think, especially when you look at the last few years when there's been so much M&A activity, right, with so many of the larger health systems, especially starting to consolidate more of the community hospitals around them. Oftentimes we talk to our CIO, colleagues, they tell us over and over again, I don't even know what I have, right? I inherited, these 3 things, 4 things, from these different health systems. I've now, implemented Epic across them, or I've implemented, Oracle across them. Great, because that was their primary EMR. But what about all those other systems, right? What about the enterprise imaging system? What about, everything else that they have? What they find is they've just got all these different ancillaries out there, and sometimes even just smaller departmental tools that nobody's taken a look at in years. And so, going in and helping them really do a solid inventory about everything they have and now that they've acquired, and then how we help them rationalize that, come up with a plan, look at the actual contracts, right? Some of the contracts may still have 3 years left on them, so you can't get rid of them tomorrow, right? But others may actually be coming up for renewal, next year. Why would you let the auto renewal happen if you know you're going to need to, sunset that application? Again, if there is already a module running that's now in your new EMR platform, then we can obviously, go ahead and turn that down, decommission it, and then, figure out what to do with it next, right? And that kind of automatically leads into well, then how do I archive this, right? What am I going to do with these applications, now that I have a rationalized portfolio? And more importantly, what am I going to do with that data, right?
Yeah.
And where am I going to store it? How long am I going to store it, right? HIPAA, has anywhere from 5 to 11 years, right? Depending on the state and, what the type of data is on how long that it needs to be stored.
Or pediatric data can be even longer than that, right?
25 years in some cases.
Exactly.
So Dave, you mentioned though that ability to like catalog, because you have things you don't know about. Beyond the application, there's going to be the connectivity, whether that's going to be the interface, and sometimes it could be a dedicated pipeline going out there. That whole continuum of understanding your complete portfolio is so key. How have you helped some of those customers when you think about that? Because when you have an abandoned interface, and every once in a while, it could still be transmitting things to other places or going into these like orphan environments. What are some of the things you're seeing there? Because everything is now connected to everything else. It's not like we just turn off the app and things stop moving around. There's still stuff moving around in the ether. How do you help people get there?
Yeah, so that's actually interesting. From my background, I started my career in healthcare as a cloverleaf interface engineer. So I wrote a lot of
You're
those
my
interfaces that
guy.
you're talking about.
Yes.
Yeah, so I've been, near and dear to my heart is integration and interoperability. And, to me, this is, a big part of the archiving conversation. And a lot of people miss this, right? They don't think about the fact that, yes, these systems are all interconnected and that there is data that are in each of these individual siloed systems that are not in everything else. Sure, some of the data is interfaced between them, but it's not like we're actually replicating all of the data that's in an ancillary system into the EMR or into the EHR. We're not, right? So there is a subset of data that's always left behind. And as those applications are decommissioned, you're right, you have to go to each of those endpoints. Hopefully it's an interface engine in between, so it's a little bit easier and it's at least consolidated. But for those that are still doing point to point, and are, especially now in the days of APIs, there may be more of them that are point to point, that the APIs are talking directly to each other. You've got to really think about how we're going to turn those off. But when I start thinking about, archiving in general, it's like, okay, what data in that system is not in my EHR that I do need to archive off, right? That I do need to save. And then how often am I going to have to access that data, right? All the archive vendors love to tell you how they can take all that data and very inexpensively store it for you in the cloud for that length of time. That's great. But that's not what kills people, right? What kills people is the access. It's now, a year later and a court case has come up or something else has come up where I need to access that data. Or I'm trying to do some good population health management and I need to access that clinical data, right? The access of it is where the cost comes in. And the sticker shock behind that access sometimes really shocks organizations that we work with because they didn't think of that when they were laying out their strategy. And then I'm going to, pivot a little bit here to this idea of AI, right? Now you start thinking about AI and I want that AI model to not be based on just, the current active data, but hey, I've got all this data, right? I've got 10 years worth of data that's in my archive vendor. If I want to bring that into an AI model and actually use it to help make better decisions about patient care or about financial operational decisions, how am I going to do that? How am I going to access that data in an economical way to even allow it to participate in my AI strategy? And did I normalize it? Did I make sure that it was archived in a way that, it could be rationalized itself and pulled into those conversations and into those models? Chances are you didn't, right? Because you weren't thinking about how am I going to use the data 5 years down the road. You were thinking about how am I going to actually just get it off my current system, right? I want the cyber exposure gone. That vendor sunset that application, right? They don't patch it anymore. The operating system that it runs on doesn't produce patches anymore. So I just need to get it off, my systems and into the cloud. Great. But now what do I do, right? The operation wants to access it and I can't get to it. Does that make sense?
Yeah. It's always interesting to, kind of think about the legacy systems that are out there. I was reading something the other day, an article that was written about the number of legacy systems that continue to exist in healthcare systems because they need that data for something, compliance reasons, if nothing else, and they continue to pay some kind of extraordinary maintenance cost to just keep those things running so that they have access to that data. And a lot of that data was just stored, as you said, sort of in production. It's just a place we got to put it. It's just part of the system. So being able to pull that out, put it in an archive in a way where the data is usable and accessible, it really is an interesting use case, this AI use case that you bring up, because sometimes when you go back and look at that historical data and you have an artificial intelligence capability to go back and look at it, you find patterns that you would have never found on your own. You see things that you would have never figured out on your own. That's why the right kind of archiving is kind of like the best decision, right? The most important version of that archiving decision.
It is. And we've literally just recently helped an organization go through the strategy of, do I need to archive my archive vendor? Because I didn't think about all this stuff ahead of time. And the current financial structure that I have with my archiving vendor isn't going to work if I want to go this way, right? We've even, talked through a strategy with an organization of how do I pull the archive back in house? How do I not put it in the cloud? Because I want to access it so much that it wouldn't be financially viable to keep it in the cloud, right? It's just not going to happen with the AI initiatives that I plan on doing, with the analytics and stuff that I want to do on top of that data. The cloud is just not economical, right? The access fees, the network fees, right? The storage fees are cheap, right? Storage is one of the cheapest things we can do nowadays. But when you actually think about all those other components to it,
Yes,
right?
the
Because
ins
they
and
charge
outs.
every single time, AWS, Azure, Google, doesn't matter, right? Anytime you log into any one of those clouds, that network traffic is where they're getting you, right? And so if you're going to try to do something that's going to continuously access that data store, the fees are going to be just exorbitant.
We
So if
were
I pull that back in and take it out of the cloud, now I can do what I want with it.
we were having that conversation the other day with somebody, Sarah, I can't remember who, but the conversation about what are the right things to bring back on-prem. A lot of folks have sort of gone through this
Yeah.
process of push everything to the cloud, push everything to the cloud, get out of the data center business, don't want to be in that business. And now we're seeing a lot of people rethinking that strategy around maybe I can have my own internal cloud for data that I'm going to use, like really heavy duty use. I need to have it on-prem now because I can better manage the cost. I can better manage the turnover of the hardware. I can do all those things myself. And as you said, you see those bills just ring up in the cloud. You're seeing a ton of that, huh? Like a lot, or is it just this is one of the things people have to think about?
It comes up in every conversation when we're talking to a client about archiving, right? We start to, because again, a lot of them, unfortunately, are sold the sales pitch, right? They're sold the sales pitch from the archive company, and the fees from a storage perspective just really don't look bad,
Sure.
right? And when you see that access fee, you just don't know what the volume of it's really going to be. Because again, a lot of times they haven't thought out the strategy, right? And so, so many people think archiving is just, I've got these 10 applications, there's this many terabytes of data, this is what I need from my archiving vendor, I'm done. But they don't think operationally, how often am I really going to access it? So look at
They
those
think about
access fees, really think of that.
they think about these tiny use cases too. For that particular
Right.
system, we need to archive it because we need to work down AR in that system. And probably for the next 90 days, then we're probably never really going to need to touch that data again until they get into this AI conversation. Sarah,
That's right.
you've talked to a lot of folks about this too.
I have because, I mean, the CTOs especially, I mean, they're so focused on the fact the proliferation of that storage need, of the ability to have all things from an imaging perspective. I have yet to have a conversation with somebody who's really solved the imaging storage equation. And so, Dave, I'm curious from your perspective and what you're seeing out in the marketplace as well is, there's going to be different levels, deep archive, tertiary, et cetera. But when it comes to the explosion of imaging, especially in the usage, to your point, of those new algorithms that are helping people detect things better and faster and looking for longer term trends, what is the right place to start with the imaging storage cost conundrum?
This is another one where we do focus folks back towards on-prem, right? Again, from an archiving perspective, the size of that imaging data and the number of, bytes that it's going to consume from a network traffic perspective to move that back and forth through the cloud, that's where the fees just become too exorbitant. We're actually doing a very large, enterprise imaging at a current client right now up in Boston. And, that's a big part of our strategy for them is, where are you going to really put this store? And again, don't think about today. Right now, they're very focused on the fact that they have multiple imaging systems. And so they have, each of the ologies are all fighting for, right, what they want out of the new enterprise imaging system, which is fine. And we'll make sure all those requirements are met. But it goes beyond the system selection. It then goes to how is that archive going to be used in the future? What do we plan to do with it? Are we going to bring in, AI technology that's going to read those images for us? And if we are, what's that look like? Or does our enterprise imaging vendor provide some of that AI capability already? Or are we going to do our own studies? This happens to be, a teaching hospital. And so they're going to do some of their own, studies, right? They're going to have students who are going to want to, do research. A cloud environment with imaging, it's just going to be too exhaustively expensive. So that's where we feel they're going to almost have to pull it back into an on-prem conversation.
I think that's what we're also starting to see, though, like how roles have changed organizationally, how people think about things. It's not just, hey, we're going to put these boxes over here, these boxes over here, we're going to pull this information out of there. In the relationships that you have with your customers and some of the things that you're seeing trend out there, how have the roles of the leaders and the individuals changed in terms of their thinking on some of these? It's one thing to say, we're going to go swap EMRs. Oh, we're going to go swap vendors for imaging as an example. But that brass tacks decision-making capability really comes into play. And so what are you seeing in terms of how people are showing up to have these discussions?
Well, Drex, kind of as you mentioned early on in this conversation, right? The world is under a lot of margin pressure right now. I think that's why we've seen a lot of CIOs all of a sudden report to a CFO, right? Whereas before they were, sitting at the table. Now all of a sudden they're reporting to the CFO. And I think a lot of that has been driven by these different margin pressures that the whole market is dealing with right now, right? Whether it's the big beautiful bill, whether it's some of the other, changes to Medicare and Medicaid, those pressures have made those roles kind of change. And, we're even seeing organizations that are kind of splitting responsibility where the CIO is taking over kind of more maintenance of the IT environment, and the COO is taking over, how they're actually going to then deploy, especially like in these M&A environments where, they may be rolling out the new EMR across every one of the acquired entities. There's now a new, deployment group that is now reporting into the COO side to handle that rollout of the operation versus, the IT side is now taking over more the maintenance of the, I hate to call it the legacy environment, right? But the current
trains
system.
running.
Yeah.
That's correct.
Let's go to the M&A space, though. Let's kind of round out our conversation with that M&A, because I'm a firm believer. Now, this is all going to be cultural and organizational to a degree, but I've been in enough organizations where M&A has always been part of the equation, Dave. And so my vote is integrate as soon as possible, because the longer you wait, the more just particulars come down the road, mostly the human aspect. From all the work you have done, and Drex, this will be important from your perspective as well. When you're doing M&A, when you're bringing things into your house, what's your philosophy on that?
Well, it depends on what level you're talking about. You're talking about IT, you're talking about people, you're talking about, processes. I think overall, our general philosophy, and we do this even within our own business, is the principle of do no harm, right? You want to do no harm, first of all, especially when you're dealing with a clinical system, if you are going to go to IT, right, into some of those processes and workflows. But we do agree with you. There is also got to be a certain amount of ripping the Band-Aid off, right? Yeah, you're not going to make everybody happy, but as long as you're not doing any harm, making them happy is kind of a secondary consideration, right? Because you've got to make the changes that are necessary to bring the organization together and to get the value out of, the reason why you bought the thing in the first place, right? So there's got to be a balance there, I think, between those two. But where was your question more specifically focused? Was it on the IT side or was it on the human capital side?
I'm going to say it's both, because my answer is always the technology is already there. When you consider, to your point, you just bought a new practice. What was the point of buying them? Like, what did it mean to achieve for us? Was it market share? Was it an advantage, access, whatnot? But then how long do their systems stay alive? This goes back into, are we integrating the data or not? Do we leave it in an archive capacity? Why are we bringing certain things forward? How much is that going to cost? How do we retire all of this? That's why for the years that the CIO pulled away from the CFO reporting structure, maybe it's leaning back in there. It's like, okay, but there's the financial aspect is one piece, but the operational components and really some of those like brass tacks reasons why we did something, those often get forgotten in that planning because it's always about this one thing. And so I would say it's more about the long-term value of why we even brought something into our house in the first place.
It may be things
Yeah,
like
you're
more
right.
market share or being able to get into a particular community, but the thing that everybody just assumes is going to happen, which is really difficult to assume in a lot of these M&A business plans, because it's not often, we don't get real deep into it during the due diligence. And that is the back office consolidation stuff, not just the business operations, but clinical operations, app rationalization, and data archiving, and all those things. We think we're going to get big savings there, but we don't often plan it until after the deal is signed. I'm sure, Dave, you get pulled into those kinds of deals all the time.
Well, what's interesting is even the one being acquired oftentimes doesn't know their own inventory, right?
Right.
So they
Oh,
don't know it to begin with, so they really can't even include it in a diligence process. And when we get involved in helping, facilities plan strategically of how they're going to handle an acquisition, that's one of the first things we recommend is that you've got to go in and do, day after close, right? Start a rationalization process to really understand what you just bought and what's really there. Because chances are, as much as they do have an inventory, and all sites maintain an inventory to some level, right? It's not accurate. And so you've really got to go in and do that as a first step so you can see what you have. And then to your points there, you've got to go ahead and kind of round out, what that turn-off plan is going to be to start getting the synergy that you expected to get out of that opportunity, right? If you don't have that plan and you haven't thought through, what that's going to look like, then, again, you're kind of betting on some things with a lot of unknowns.
So Dave, when you forecast out, say 2026, curious what you believe will be the biggest lean in some of these spaces, and how do people prepare for that? What are the things they need to be thinking about going into 26 when mergers, acquisitions, rationalization, storage costs, archiving, like what's going to be like, what do you want people to know?
So I think the real thing is to, do the planning, do the strategy, right? Everybody thinks sometimes that, strategic consulting is a waste of money, right? That they've got the team, they can think through it, they can do the plans themselves. Use an expert, but not to be us, right? There's plenty of folks out there who can talk about these topics, but do the planning. Bring somebody in who's really, versed in this, who can sit down with you, who can talk about that 5-year strategic plan and what the organization is planning on doing, whether it be M&A, whether it be around specific, upgrades, whether it's consolidation, like I said, on the enterprise imaging side, who really can help you sit down from a business perspective and think through those things, and then think through the data usage and what you're really going to be doing with that data, because that's going to then drive the archiving strategy, right? What you're doing with that data is so important. And your point around integration is so critical. Understanding how in the new world, all of these systems need to be integrated. Is that integration going to enable your AI initiatives, right? Is it going to create a data set that is normalized and rationalized and is going to have the right structure that's going to enable those initiatives that you want? To try to do each of those things in a little vacuum is what we see a lot of organizations doing, right? Even taking them sometimes as point projects without somebody being able to holistically look at the entire strategy and really put that together. So take the time, hire someone, have them come in and really help you actually do that. Again, not trying to make a sales pitch for Innovative, although we're happy to help you. But at the end of the day, take the time to do the strategy. Think out 3 years, 5 years. Don't just think about, oh, right now I'm under financial pressure. I've got to go, turn off these 4 applications and get them archived. That's a short-term view. You've got to take the long view.
And it'll probably cost you more in the long run if you don't do that the way you're supposed to. So great perspective. Dave, thank you so much for taking time with us today, talking about current events, what's happening in the marketplace. More importantly, all the amazing things you're bringing to the table in terms of what you can rationalize and what you can archive. So thanks for the conversation today.
Happy to be here. Thanks again.
All right. Thanks for listening. That's all for now.
That's Newsday on Unhack with Drex DeFord. Get daily security insights delivered to your inbox because every healthcare leader needs a community to lean on and learn from. Sign up at thisweekhealth.com/subscribe and stay safe out there. I'll see you around campus.